So, hello, good morning, friends. Today we are going to discuss the first topic of the psychiatry according to us, that is neurotic disorder. So, in neurotic disorder, there are mainly seven classifications. First one is anxiety disorder that we are going to discuss today. Second one is OCD. Third one is disruptive impulsive control and conduct disorders. Fourth one is trauma and stress related disorder. Fifth one is somatic symptoms and related disorder. And the sixth one conversion disorder. Seventh one dissociative disorder. So the anxiety is common to all these seven of all. So anxiety disorder is the most common type of neurotic disorder. So what is neurosis? We can say it like anything not that is psychosis. So I want to tell you one more thing about uh, neurosis. In neurosis, there is insight, and one more thing that and reality contact. Insight and reality contact both are present in the neurosis, and both that reality contact and insight are absent in psychosis. So anxiety symptoms. Anxiety disorder is the first topic that we are going to discuss. So what are the anxiety symptoms? So anxiety symptoms can be psychological or physical. Psychological, it that means it is affecting our mind, and physical, it means it is affecting our body. So in psychological, the reason for anxiety that occurs in our mind is the due to decrease in the amount of GABA, and in physical anxiety, the cause is increase in the norepinephrine hormone. So what are the features of psychological anxiety? The features are apprehension, that is घबराहट, insecurity, and insomnia. And what is drug of choice for acute anxiety? Acute anxiety drug of choice is benzodiazepine. So this is the psychological anxiety that occurs at the time of exams or papers. So the drug of choice is benzodiazepine. And what is physical anxiety? Physical anxiety that occurs to our body, that are palpitation, tachycardia, sweating, tremors. These are the features of physical anxiety. So we can see here there is tachycardia specifically, but later we will see that there will be bradycardia in the case of blood related anxiety, that we will study further. So what is the drug of choice for performance anxiety? Is propranolol. And these are the hormones, these are sorry drugs that we discussed. Drug of choice for acute anxiety benzodiazepine, and drug of choice for performance anxiety is propranolol. So but we also discussed the two hormones, GABA and norepinephrine above, but the overall most important neurotransmitter involved is serotonin. What is this serotonin? So what is the problem in anxiety related disorder? There is serotonin dysregulation. What is there? Serotonin dysregulation. So there is further more details. Drug of choice for panic disorder is SSRI. Drug of choice for chronic anxiety SSRI. But for panic attack or acute anxiety, the drug of choice is benzodiazepine. These are the easy points. So what a doctor should recommend her patient? So the doctor recommendation should be SSRI one daily plus benzodiazepine when it is required, one SOS. BZD, we can see drug of choice for panic attack. If there is any panic episode or any acute attack, any not acute, if there is any panic attack, then we have to give benzodiazepine. Otherwise, SSRI are enough for it. Then anxiety disorder are classified under five subheadings. First one is generalized anxiety disorder. Generalized anxiety disorder, it means there is free flowing continuous anxiety to a patient, and it is shown it is chronic. Chronic means for more than 6 months. Free floating anxiety, constant worry, it's all easy to understand. Second one is panic disorder and phobia. They both are like similar. What are these? Panic disorder and phobia. Panic disorder and phobia, they both are episodic. Panic disorder and phobia both are episodic. Uh, let's see the diagram. In panic disorder, there is sudden acute paroxysmal anxiety with feeling of impending doom. Any catastrophe means here the patient feels that he is going to die or any dangerous thing is going to happen to her. Feeling of impending doom, that is something dangerous going to happen to her. That means differential diagnosis of medical emergency. He feels like that he is going to die. So there is sudden anxiety, paroxysmal anxiety, and in phobia there are similar features. But in phobia, how to differentiate from panic disorder? That in phobia there is any stimulus. Due to stimulus, we have both features like panic disorder, morbid fear with acute anxiety and panic-like symptoms. So there is differentiation that both panic disorder and phobia both are episodic, but in phobia there is an initial stimulation. Fourth one, separation anxiety disorder, anxiety on thoughts of being separated from loved ones. It occurs in elderly also. That we know that there is a love life of every guys. So, and fifth one is selective mutism. Selective mutism means child is mute in one specific condition. That means any child is going to children, he is not able to communicate or interact with other fellow beings. So it is in the school. So these are the five major headings under anxiety disorders. Second heading is type of phobia. Type of phobia: agoraphobia, social phobia, specific phobia. Agoraphobia is fear of crowded. Example, market. So fear of crowded, or fear of open spaces, or fear of closed spaces. Means we can all sum up like that: fear of places from where escape is difficult. So that a patient does not want to go in a crowded place. Social phobia: fear of socially demanding situation. Fear of socially demanding situation. Example, stage, a person does not able to feel good on the stage, all phobia. And last, third one is specific phobia. Specific phobia: fear of only one specific situation. Example, only closed spaces such as claustrophobia. So here, friends, I want to tell you one important point, that in agoraphobia there is fear of both open and closed spaces. But if there is only fear of closed space, then it is known as claustrophobia. If it is person is fearing from height, it is known as acrophobia. From dirt, mesophobia. And from spider, it is known as arachnophobia. And from night or darkness, it is known as nyctophobia. So I told you one point previously, that all the anxiety related disorder causes tachycardia, but only one anxiety related disorder causing bradycardia, and that is blood related specific phobia. So it is written here also: all phobia causes tachycardia except blood. Blood causes bradycardia and behosh. That means syncope. So that's what is, and finally, what is the treatment of phobia? Treatment of phobia is exposure therapy. That we should expose the patient little by little to the situations, so he can be grow up. Systemic desensitization, graded exposure plus relaxation more than flooding. That means sudden exposure. That means we should give the exposure gradually, not sudden exposure. So systemic desensitization is more preferable than flooding. So it's all about anxiety disorder. That is our first class about uh, in our subject psychiatry. So hope you like the video. Thanks for your support.